Okay, so we are recording now Zoom call 37. It's March 7th. Do you believe that? And it's beautiful, 90 degrees here in Minnesota. Looking out the window, there's people sunbathing outside, and there's an ocean view out of my room here. And I'm using my imagination very strongly. So speaking of ocean view, we have some news that Dr. Kelly and I want to share with everybody. Our, I want to say our goal, but it really isn't our goal. It is something that God has put on our heart. And this is the first time we're making it public, is that the plan right now is that we're going to be opening up a clinic down in Fort Myers, Florida. It probably won't be an ocean view, and I won't be down there very much. Dr. Kelly is moving down there, and she'll be heading up that clinic down there. So please be praying for us to find space for our clinic. If you are familiar with that area, I'd love your feedback. And just be in prayer for us to be protected down there and for everything to fall together. Our plan right now is to open up sometime this summer. But it's going to be totally God's will in the doing. So I just covet your prayers for that. All right, so I have you muted so I can't hear any feedback from you. If you do have comments, please chat me so that I know that I need to respond to you. A lot of questions came in. And I'm not going to be able to hit everybody's, but I'm going to hit two main ones that I think are going to take a while. So I'll try to open it up at the end of the Zoom call for more questions. So if things do pop up, please write your questions down and we'll get to them. So the first question was just some different understanding of alkalinity. How do I alkalize my body? There's a lot of information out there about using alkaline water. I touched on this last week. And there's information about, it's probably at least a couple times a month we have people say that they're drinking sodium bicarbonate or they're using alkaline water filtration system. They're trying to alkalize their body. So how do you alkalize your body really is the question. Because if you listen to our Zoom call, I think it was last week or the week before, I said the stomach has to have a pH of very acidic. And if we're just going to swallow an alkaline substance, then is that going to alkalize my tissue? Well, we're alkalizing the stomach and the first part of the small intestine. And that's where my cancer is. It may be beneficial to do something like that. But are we absorbing it? Is it alkalizing our body? Well, we absorb things through the blood. And if we are absorbing a ton of sodium bicarbonate and we are alkalizing the blood, effectually you will die. So the body is going to then buffer that alkalization of the blood to keep the blood at a pH of about 7.4. So that is what's called your body's buffering system. And if that's one of the ways that we die is our buffering system starts to fail. And then our blood becomes acidic and we die. If we're forcibly trying to make our body alkaline, let's say I have breast cancer, so I'm drinking sodium bicarbonate fluid, baking soda, or alkaline water, how do I get it to the breast? How do I get it to the prostate? How do I get it to the pancreas, the area that I want to alkalize? Well, you can't, inject it into your bloodstream because you would kill the person. You can't even absorb it through the gut wall because your blood will buffer it back down to a pH of 7.4. So how do I alkalize the tissue? Well, there was a doctor named Antonio Simoncini in Italy that was injecting people's cancer with a sodium bicarbonate solution, and he had some success with that. So that is a possibility. Inject an alkaline substance right into the tissue. Another possibility is what other way do we alkalize? Well, the rife is a great tool to help alkalize because the rife is light frequency. Hopefully we're using a frequency that's tuned to your cancer. So we're stimulating your cancer cells with light frequency, and light is different than every other waveform in that it's a photon. There's a photon. It's a particle carried on a wave form. Different than sound, different than other waveforms, electrical, etc. Doesn't have a photon. That's what makes light special. So if you hit something with a photon, that is an electron donor. And if you donate an electron to tissue, you are raising the pH of the tissue by definition. So one of the theories on how Rife actually works, how light therapy actually works in healing, is it's alkalizing you. That is also true if you go out and lay in the sun. You are basically alkalizing your tissue, except the frequencies from the sun waves, they're light frequencies, but they're not specific to cancer. So they're not necessarily hitting your cancer, but it is alkalizing your skin and your tissue and your body, whole body stimulation and alkalization because of the light waves hitting your skin. So there's some alkalization that goes on there, but when you're using Rife frequency specific to the cancer, you will effectually alkalize the cancer cells themselves, and that's one theory, like I said, on how the Rife is working. Now, how do you alkalize yourself as your whole body dietarily? Well, remember, it's not whether the food that you eat is acidic or alkaline. So if we take a pH strip and put a pH strip in lemon juice is going to come out to be very acidic. It's not whether the substance is acidic or whether the substance is alkaline, it's what it does to your body once you ingest it and absorb it and what it does to your tissues. Lemon juice, though it's very acidic, is very alkalizing to your body. So remember the difference there. So don't think that you can take a pH strip and stick it in a glass of alkaline water, and because it's alkaline, it's going to be alkalizing to my tissue. My belief, the only thing that's alkalizing to your tissue about alkaline water is the fact that it's water. It's not the fact that it's alkaline water. So water itself is going to help alkalize your body because it's going to help flush your body. And what is it going to flush? It's going to flush waste. And what is waste? Waste is made by the cell through metabolism, and it's spewed into the extracellular spaces, carried away by the lymph system, and increased water consumption will help that detoxification process of the waste. So in the fact that it is pulling acidity out of your body, it is hence alkalizing your body. So here's a nice little list about some foods that if you eat more green leafy vegetables and good fats and such, it's going to be more alkalizing to your body. If you eat more junk food, soft drinks, stuff like that, it's going to be more acidifying to your body. Now, the purpose is not to, oh my gosh, we're going to only eat things here in the dark green here, and we're never going to eat any of these things over here in the orange. You're missing the idea. It's about balance. It's about detoxification. It's about cleaning your body out. It's about having a balance. So we wouldn't want to make ourselves, let's put it this way, it would be just as damaging to be overly alkaline as it would to be overly acidic. Same problem. So we don't want to make ourselves overly alkaline. Now somebody will say, well, you can't really because all these things that we're eating are causing an acidic reaction in our body. Well, if you clean up your diet and you're eating really good, could you be overly alkaline? Well, maybe not, because environmental toxins are going to stimulate more waste, etc., and you can't get away from those no matter how hard you try. So the idea about alkaline, acidity, and pH balance in your body is the biggest thing is your diet. Cleaning up your diet, eating good organic food, green leafy vegetables. People don't eat enough of that. People are big giant meat eaters, and those could be acidifying. If it's okay on your diet, as we tested you out that it's okay to eat meat, that doesn't necessarily mean that you're supposed to be eating meat 3 times a day. That means you can eat meat once a day. You still have to eat a lot of vegetables, and you have to balance that out. You still have to be drinking a lot of water, still have to be watching the pesticides and chemicals and everything else that you're eating. So use this chart. I just downloaded it on the internet. I have no idea what Life Tones is here down in this corner, but it was a great chart. Whoever made it did a great job in the infographics. Hopefully that will answer most of the questions about acid, base, balance, and pH, and having a healthy pH of your tissues. All right, next question regarding prostate cancer. We've been told that we need to stop the production of testosterone. Is this true? So there's a lot of disagreement, we could say, about prostate cancer and testosterone. Some information that's out there say that the reason why you have prostate cancer is that you have too much testosterone, and every prostate cancer patient will be offered through their oncologist some sort of testosterone reducing medication like Lupron that is going to reduce and eliminate testosterone in their body. And the argument is, well, why do I need to do that? Well, because testosterone feeds cancer and will cause cancer to grow even more. If that was true, if excess testosterone caused cancer, then the argument would be, then wouldn't you think that most 18-year-olds would be getting prostate cancer, not 50, 60-year-olds getting prostate cancer, because your testosterone levels are much higher when you're younger. Now, there's an argument that excess testosterone can cause cancer. So I don't think that, I think the evidence is fairly clear with that, but we're not talking about excess testosterone in 50, 60-year-old people. Matter of fact, there's no increase in prostate cancer with people, with men that are 50, 60, 70 years old that are going on biological hormone replacement therapy, where they're greatly increasing their testosterone from natural levels, because our testosterone levels are going to decrease when we get into our 40s, 50s, and 60s. And the people that are on hormone replacement therapy don't seem to have any increase in prostate cancer risk. So what's the deal with that? Well, I'm just going to give you some information that's out there. You can Google testosterone and cancer and prostate cancer risk just as well as I can. There's a lot of research data that's out there. This study right here is a meta-analysis study, and a meta-analysis study looks at a bunch of different data that's out there. They said that testosterone is not a risk for prostate cancer, but, and the but is if you have excess testosterone. Well, pretty much there isn't very many prostate cancer patients that have excess testosterone. So that's not really a risk for any of my patients. However, you get articles that show you that testosterone and prostate cancer, evidence-based review of pathogenesis and oncological risk, meaning is there an increased risk? And the studies say, no, there's not an increased risk. But however, this is a clip right out of the American Cancer Association. It says hormone therapy known as androgen deprivation therapy, or ADT, or androgen suppression therapy. That's the Lupron shots that people are getting. The goal of this is to reduce the male hormones, androgens, to testosterone, because they could be feeding prostate cancer cells. But then look at this, in the last sentence of this, it says, but hormone therapy alone does not cure prostate cancer. So even the American Cancer Association admits that hormone therapy is not reducing prostate cancer reoccurrence or metastasis of prostate cancer. My belief, especially as you look at some of these other studies, we're going to talk about sulforaphane, and Dr. Kelly's going to do a whole kind of webinar, Zoom call next week on sulforaphane. There's other ways that we can decrease this prostate cancer risk other than trying to reduce the PSA. So the whole idea with decreasing testosterone is that it does decrease a person's PSA. However, just because a person has low PSA does not mean they have a decrease in overall uh, metastasis risk. So I have patients, and that's why a lot of studies have been shown in the last 10 years of why looking at PSA is not your main marker. Matter of fact, I remember seeing prior to Lupron becoming the go-to drug for prostate cancer, and the whole thing going on about 10 years ago was that we can't look at PSA anymore because PSA is not an accurate marker of whether the person's prostate cancer is getting worse or not. Because the truth is people can have a PSA of 15 and their cancer burden, their tumor burden is very high, and they have their cancer, that means their cancer is growing more quickly and metastasis is taking place. And there's other patients that have a PSA of 400 and their tumor burden is actually fairly low, meaning it's growing very slowly and there's no metastasis taking place. So about 10 years ago, PSA was basically being thrown out, and all the studies that were up were we need to find another marker for prostate cancer because PSA is so gosh darn unreliable. But then they came up with Lupron, the idea that if we could use a drug to get rid of testosterone, let's see what happens. So they came up with a drug that diminishes and suppresses your testosterone levels. That in itself could be problematic with most men. So, but if we can diminish the testosterone levels, we will effectively reduce the PSA. And there seems to be a fairly close correlation. It's not perfectly one-to-one, but if we give most men Lupron, we will drop their PSA. And then you can have the idea, if you equate a low PSA to tumor burden, you'll go, oh my gosh, we've really helped this person because we gave them this drug, it reduced their testosterone, and their PSA went down to, let's say, 0. That's fantastic. The problem is if you are a doctor that is treating cancer patients, prostate cancer patients, you will notice that, okay, we notice that we have patients that are on Lupron that their tumor burden is high, meaning they have metastasis to the sacrum, they have metastasis to the hip bone, they have metastasis to the liver. What the heck? They're on Lupron, they have a low PSA, and their cancer is growing like crazy. So even though the Lupron is effectively lowering their PSA, the question is it lowering the tumor burden? Well, that's an argument that needs to be made, and that's some studies that need to take place. So I'm not against you doing Lupron. I'm not against you doing androgen suppression therapy. Is there any negative effects to reducing testosterone in a person's body that are going to increase cancer risk? I doubt it. I don't believe there is. Are there negative effects that men don't like to have? Side effects from androgen suppression therapy? Absolutely. And anybody that's been on Lupron could give you a list of things that they're not happy with and how they feel. But that's another story. Really, we want to go, we don't just want to maybe artificially lower PSA and then give myself a false feeling that since I have a low PSA, my cancer is not growing anymore. We want to try to make sure that we're, even if you decide to do that, we want to make sure that we're decreasing the tumor burden. Ultimately, because, I mean, we could have low PSA and have metastasis for my prostate cancer all over my body and I pass away with a low PSA. Well, what good was that? It's kind of like, I liken it to using uh, uh, a drug for lowering your cholesterol, a statin drug, thank you, for lowering your cholesterol. So if I have high cholesterol, and my cholesterol is 275, that would be considered high cholesterol. And I'm going to take a statin drug. The statin drug will effectually lower my cholesterol, but it actually doesn't do anything for the reason why the cholesterol is high in the first place. So it's actually not reducing my risk of everything that increased cholesterol causes risks for. And studies have been shown that just because a person goes on a statin drug does not reduce the risk for heart attack and strokes and everything else. So it's like all you're doing is artificially lowering a lab value to make the person think that they're healthier when you're never correcting the reason why they're not healthy in the first place. And that is kind of practicing what could be called deceptive medicine. So we might as well just take the lab value that we get back and erase the number and put down a number that suits us better, and then give it to the patient and say, see, you're doing better, because they're not really doing any better. You're not correcting the reason why it's there. You're just artificially lowering a lab value and giving people a false sense of security because their lab value is more normal, while you're not actually correcting the reason why the lab value is out of normal. So you could use a drug to change lab values, but are you really helping the patient? That's the question. So regardless of whether you choose to do Lupron or not to reduce your testosterone to then lower your PSA, you still want to do everything you can to change tumor burden. And that's where we get into studying some of these other things like sulforaphane. Studies out there are coming in droves, and this is what Dr. Kelly's going to talk about next week. Study after study talking about sulforaphane, and sulforaphane is a product that is from broccoli. So yeah, you can eat broccoli, but you have to have it fairly high concentration dose. And I'm not going to get into all that because I'm going to leave that for Dr. Kelly next week. And we are actually producing a product. Now, there is sulforaphane that you can get in capsule products. And the problem with any product, so this is how our brain works, just so you understand how we think and we talk all the time. And but you can take a product, whatever cancer killer product there is, and you can test it in a test tube setting, and you can see effectual changes to the cancer, that it's quote unquote killing the cancer, and then you can say, well, we need to do this in vivo and get it into a patient study, and you can see it in a patient study. But then the problem always comes in is to all these other factors. How well is the person's digestive system? Are they absorbing it well? How well are they getting it to the tumor site? Depending on the tumor site, how vasculated it is. So if I get it into the person's bloodstream, can I get it into the tumor itself? What are the best ways to do that? So these are the kind of things that go through our mind. So we could give a person sulforaphane, and we do this with products called Broncho Protect and such, but how are we going to get it to the prostate or to the breast? Because sulforaphane is not just for, I just pulled up the prostate studies. Most of the studies are done with actually breast cancer. So any of the hormonally driven cancers, sulforaphane is coming up study after study as it's so beneficial and protective, even if you don't have cancer. And that's what we're going to be speaking about next week. But how do we get it to the site? So taking it orally is one way. We're coming up with some other ways to do it. And we're going to come up with some tinctures to take it also rectally and vaginally, and basically getting it into every orifice. So it's sublingual. So we could get a better absorption rate, and we could get a better concentration in the bloodstream, and even coupling it with things that will help bring it into a tumor better. And coupling it even with, these are some things that we're thinking about, with timing rates when you do the RIFE. Because if I'm running the RIFE, let's go back to prostate cancer a second. If I'm running the RIFE on prostate cancer frequencies, those frequencies are hitting that prostate cancer, and it's doing all sorts of things to that prostate cancer. I mentioned that it's alkalizing that prostate cancer, but it's also causing those cells to vibrate, and I believe it increases uptake. It increases the vascularization, so uptake of chemotherapy if you're doing chemotherapy or immunotherapy, or your specific nutrition. So one of the things that we're doing studies on is when you take your nutrition. Right now we have people taking their nutrition during the daytime. We're talking about possibly tweaking things where we're going to have them take the nutrition right when they do the Rife machine, and it increases the uptake of the cancer. So these are the kind of things that go through our mind as we bounce things off our head, because both Dr. Kelly and I are obsessive compulsive about trying to figure out how to help our patients, which is not always a good thing, but it's a good thing for you, I hope. So that's what our goals are. So watch for this coming up next week of when we're going to be presenting some of this stuff as well. I'm going to open it up for questions now, so I'm going to unmute everybody. So if you're chewing on corn chips, please mute yourself. Does this bring up any questions?
Dr. Connors, this is David once again. I don't have a question at this point, but this was a really good explanation on the prostate and the testosterone approach to cutting that off, cutting that supply off. It never made sense to me, but I couldn't put it in words that you know, that I could only explain to anybody else. So thank you for the explanation. It's been very helpful.
Oh, you bet.
Yeah.
Dr. Connors, I have a question.
Uh-huh.
I am on my second round of FMD diet, and this is my second day. I am experiencing shakes. Like I can't get settled, and when I write, I can see my handwriting's off. It didn't happen the first time.
Okay, so you're doing the FMD diet and you're getting the shakes. Do you have a glucometer at home?
No.
So a glucometer is a little device that measures glucose levels. Most likely your glucose is too low. So the second time I did the FMD diet, I had the same thing happen actually on the second day too.
Oh, okay.
So I checked my glucose levels and it was down to 60. And that's, so that's probably a little low. Now, if you just look at normal glucose levels are typically, you know, there's different groups that give different ranges, but normal is typically 70 or 75 to 85, 70 to 85, and 60 would be considered hypoglycemic. Now, if you're trying to get into a ketogenic state, people that are in full ketosis, 60 can be normal. However, they've gotten themselves into a state of ketosis so that they're burning ketones, so they're not getting a hypoglycemic effect from low blood glucose levels, because they're in a state of burning ketones, so they're not having any of those effects. However, you're not in a state of ketosis, and you're going to have the ill effects of low glucose. So I would say you're just going to have to break the diet a little bit and eat a little bit something.
Okay.
Can I ask you about the prostate, going back to the high testosterone levels for women? When they're growing hair on their lips and their chin, is that an indication of anything bad?
No. I mean, normally women have testosterone levels just as men have estrogen levels. So usually that's a sign of an imbalance. So here's the deal. When you're exposed to exogenous hormones, meaning hormones from your environment, because we all are, we're exposed to hormone disruptors, like from plastics, and you're exposed to estrogens from plastics and all sorts of things. They're in our drinking water. You can't get away from them. You can run, but you cannot hide. You're exposed to bad estrogens. Those things are supposed to be detoxed through your body, but they're not all detoxed, and they settle in your cells. And then you have an enzyme in your cells called aromatase that aromatizes those into testosterone and bad estrogens. So that's why you could get an increased level of testosterone or an increased level of bad estrogens in your body that can, especially the estrogens, could lead to cancer, and testosterone could lead to things like you're talking about. So is it bad? Yes, it's a sign that maybe you have higher levels of testosterone and its precursors, or some of the 16-hydroxyestrones and estradiols that we don't want to have. There are the best lab test out there right now is a test called the Dutch test, which is a dried urine hormone test, which measures not only just, a lot of people will send me a test, oh, I had this hormone test done, and it's all it is estrone, estradiol, testosterone, and progesterone. And it's like none of the precursors, none of the different separations of the hormones of the estrogens are run. So you want to get the precursors and the separation of the hormones in a test, and that's the best test out there. So if you're looking at where are my hormone levels at, you have to run a test like that to get some numbers to see what we need to really work on. Now, that being said, a product like the broccoli product that we have can help pull out bad estrogens. That's why you would use also DIM. And that's why you would use a fermented soy product like the Sanogastrel. And that's why you would use that even if you don't have breast cancer or a hormonally driven cancer, because you're exposed to these estrogens that can be harmful for you and that can cause cancer. The way the estrogens cause cancer is that they attach to the apoptotic receptor sites, so they don't allow apoptosis to take place. So hormones are causing a lot of bad things, not just cancer. So looking at a hormone test can be beneficial for a lot of people.
I have a question.
Okay.
Okay, this is actually Liz. Liz has a question.
All right, Liz.
My C scan with contrast after my chemotherapy was fine.
Okay, hold on one second, Liz. We're getting a lot of feedback from somebody breathing into their microphone or something going on in the background. If you know that's you, please mute yourself. I don't know who it is. So go ahead, Liz. Speak real loud if you can. All right, hold on, Liz. Hold on. I'm going to mute everybody, and I'm going to unmute Liz, okay?
Week.
Okay, all right. So start over. I had you muted. Sorry, Liz.
Oh, I'm sorry. My C scan with contrast came back showing no metastasis anywhere in my body. So my radiation, which they were going to give me 6 to 8 weeks, 5 days a week, was changed to brachytherapy, which 3 doses, 3 15-minute like cone to where the cancer started in my uterus. You know, in a cone in the vagina pointed toward it. I've had 2, and I've got 1 more Friday with relatively no side effects. And I was just wondering if there, what you had told me with the chemo, which I thought was wonderful, I didn't know that, to fast the day before and the day of getting the infusion, it would help me. But the radiation, it's like nothing happens.
Right. So there isn't any studies that I know of that that say that fasting prior to radiation is beneficial or not. There's maybe some of that is ongoing right now, but nothing that I know of. It is, I think the benefit of fasting prior to chemo is because chemo is a chemical that's put into your bloodstream that is toxic, and fasting creates the cancer itself is starving for food because you just effectually cut off its food supply yesterday because you didn't eat anything. So it's going to be uptaking anything it can, and when you inject chemo into your bloodstream, it's going to uptake the chemo better instead of the chemo targeting basically widespread systemically. It's going to be uptaken by the cancer more effectually. So that's where the benefits of fasting prior to chemo come in. But with radiation, you're targeting it to a certain area that's not going systemically per se, and it has nothing to do with a chemical response. It has to do with just the physical effect of the radiation. So I don't think there's going to be a lot of help, even though you're not having any problems, which is good.
I'm
But
trying to hydrate well, and
yeah.
The foot bath. I would love to know your thoughts on when I take the chemo and the radiation. Increase the foot baths, do them that night.
So typically when you do chemo, if a person is doing chemo, you want to wait 48 hours to do the foot bath after the chemo, because you want the chemo to work. You don't want to just pull it out of your body. I mean, what's the sense of going through chemo, right?
Right.
With radiation, that's not the case. You could do chemo, you can do the foot baths right away.
Thank you.
So you do them right away. You don't want the radiation systemically. So you want to pull that out right away.
That's good to know. Thank you so much. Very good.
Okay, I'm going to unmute everybody again. So any other questions?
I have one.
Okay.
Diane here.
Okay, who's talking?
Diane.
All right. Go ahead.
Okay, so this is the deal. When you are doing the rife, would it be a good idea?
Okay, hold on, Diane. I got to mute everybody and unmute you, okay?
Thank you.
Good.
Hold on. Okay, go ahead.
Okay, great. Okay, so when you're doing the rife, would that be a time that would be appropriate to drink the suspension drink, the green
Well,
drink?
that's the thing that we're studying. So that's the thing that, so much of everything we're doing is like nobody else is doing this. So we're like trying to figure this out on the flow here. But as you think through a little bit, okay, what is the rife doing? The rife is stimulating those cancer cells. And I will tell you, the patients that we have doing chemotherapy and immunotherapy seem to be doing so much better than the average person doing chemotherapy and immunotherapy. And I can't help to think that the rife is at least a piece of that. We had 2 people doing immunotherapy that are at Mayo, and one of them, the Mayo doctor, said, "You just basically set the record. We've never had anybody do so well. This is unbelievable." And I can't help but think that the rife is helping the immunotherapy target the cancer cells instead of every cell, because I'm not going to get into how immunotherapy works, but we had another patient that he said he got his first scan back, CT scan back, doing immunotherapy, only 3 sessions for him, where his tumor shrank, and they had only given him months to live. So he's ecstatic. So then my thought is, well, maybe we should do the same thing with our targeted nutrition that we tested you out for as the cancer killer. Should we be taking that right before you go to bed when you're doing the rife at night? So
Exactly.
that's something that we're going to be asking people to start experimenting with.
There you go. That will be part of that.
Okay, great. So we'll be contacting you and kind of explaining that. Actually, I think I'm going to make a video about that. Okay, I'm going to unmute everybody again. Any other questions?
Dr. Connor, the turmeric that you have us taking, is that one of those kind of drinks that you would want to take with the rife before you go to bed?
The turmeric?
Yeah, turmeric and liver ND.
So your drink that you're taking, who am I
Yeah,
speaking with?
during the day.
Oh yeah, so that's one of the things that maybe we should do that right before we go to bed.
Okay, do you want
Or
us?
at least a part of it. Maybe your second
Okay.
drink should be done right before you go to bed. Your first drink in the morning so that then you have at least that infusion of that nutrition throughout the day. And then the second one, instead of the afternoon, do it right before you go to bed. That's what our line of thought was.
It won't hurt the sun spectrum then?
No.
Okay.
All right, any other questions?
One little question, Dr. Connors. One of the things that we have here as part of our miso. What's your feeling about using a 3-year-old miso?
What do I feel about using 3-year-old miso?
You know, it's aged, it's fermented food.
But miso is a fermented soy, right?
Correct.
So the benefit, remember the difference between soy and fermented soy.
Yes.
So soy is not good because it is basically an estrogen. Fermented soy works to help dislodge bad estrogens from apoptotic receptor sites. So the greater amount of fermentation of that soy, is it more potent? I don't know. I don't know the studies on if that's true or not. You'd think maybe. Maybe.
All right, I'm going to stick with it for right now, so we don't know.
Okay. Any other questions?
Yes, Dr. Connors. This is Lewis Wright. How you doing today?
Hey, Lewis. How are you doing?
Doing fantastic. I just want to thank you guys for your wonderful care up there a couple weeks ago, and just had a couple of questions for you. I went over the thermogram with Angie today. And
so hold on, Lewis. I'm going to mute everybody else, and I'm going to unmute you. Okay. Okay. Are you there?
Yes, much better.
There. It feels like I think somebody's
just a question.
Somebody's vacuuming their computer or something. I don't know what it is. Okay.
Yeah. First of all, how you doing?
I'm doing super.
Good to talk to you. My first time on the Zoom call.
Oh, I'm so glad you made it.
This is great. Yeah, a couple of things on the thermogram, and I had one done just about a year ago, so they had a comparison thermogram, but it showed some problems with the thyroid, perhaps. And Angie was mentioning getting my thyroid tested. What are your recommendations on testing for that?
Okay, so let's talk about thermography for a second here. So thermography is a great tool because it measures heat, and if I have an increased heat, then you go, what is that from? So it can be from an increased metabolic activity, like a cancer growing. It can be from increased metabolic activity from like an autoimmune disorder, that like Hashimoto's of my thyroid. It can be from inflammation. So if I have inflammation because of an infection or something like that, it'll show. The negatives.
Well, it's interesting because I'm sorry. I'll let you, because you're doing this for your benefit of your other patients.
No. Tell me. What's your question?
No. I was just going to make a footnote to that, but if you wanted to continue with the thermography description for your other listeners, they might want to hear it as well.
Okay, so there's negatives too. Thermography is not going to be a tell-all. I can diagnose my colon cancer through thermography. So thermography is going to be more sensitive to upper body areas. Breast thermography is phenomenal for helping to pick up breast cancer earlier
Right.
than mammography will. It'll pick up dental problems where nothing else will. And dental problems can be major feeders for throat cancer, anything in the mouth, breast cancer, lung cancer. Dental problems are huge. Besides the fact that even though maybe a subacute, meaning or excuse me, subclinical, meaning that it's not even quote unquote clinically diagnosable or quote unquote clinically relevant, a subclinical dental infection can be a secondary cause to all sorts of problems, including heart disease and autoimmune issues, and absolutely certainly cancer of any area of my body, because it gives me this chronic subacute infection that's just dragging my immune system down over the last 15 years, and then that sets me up for cancer. So dental problems are, if all we could diagnose is dental problems with thermography, it's worth doing thermography. And
Well, that's
probably about
sorry.
75% of our patients, honestly, have dental infections shown on thermography.
Well,
The negative of thermography is also this: it's read by radiologists, which don't get me wrong, I think radiology is, you know, a wonderful profession, and if you're a radiologist, don't send me hate mail. However, the radiologists, all they're doing is looking at them, looking at pictures, looking at pictures, looking at pictures, looking at pictures, and we get comments
sure.
back from the radiologists to our thermographers. Oh, do they have breast implants? It's like this was a question just the other day, and Anne wrote back, I checked, yes, they have breast implants, and they wrote back, I asked, did they have breast implants? They don't even read their own stuff. So it gets a little frustrating when they're just running through films so quickly, and quite honestly, those comments that you see in your report, sorry to say, they're not typing these out, and they're not dictating them and having a secretary typing those out. They're clicking boxes and it's formulating sentences. So they're going through there, click, click, click. Oh, there's heat in the throat there. Oh, click possible thyroid problems, and it generates the sentence to basically cover their tail. So they probably didn't even look that you had cancer where you had cancer when they clicked that box. I hate to say that. So
Yeah,
you have
that's
to go
interesting.
more off of what Angie and I tell you about your thermography report than what they're telling you. Just so you know. So when you guys get your thermography report back, you're better off talking to Angie about what she thinks is going on. If she ever sees something weird, she brings it to my attention, and I say, oh, tell him this or that. So you're, no offense to the radiologist reading the report, but they're not really in tune with the patient themselves. They're just throwing films up really quick and writing and clicking boxes. So quite honestly, Louis, I would not get your thyroid checked.
Okay.
I
Yeah,
don't think
understood.
that's
Yeah, it's interesting because I was telling you that I had a crown extracted, a molar extracted about 3 months ago, and that I was still having pain in that area. I went to the dentist today, and there was actually a cavity that was behind that molar and the other tooth up on the inside at the gum line, and he just filled it today, and the first time since May of last year that I'm not in pain.
Oh my goodness.
And it might have been the issue the whole time. I might have had the tooth pulled for no reason, but yeah, so
Crazy, huh? And this is the problem with, if you're looking at I am really good at reading x-rays, because when I went to school, I had the wonderful fortune of having one of the best radiologists ever to live as my instructor, who happened to be at my university writing the main manual that's used in most medical schools today. And he was my instructor. He's from Australia. He was fantastic. But dental x-rays, including bone x-rays, skeletal x-rays, really are not good at seeing infections. So I've had many times where patients have gone back to their dentist and said, I had a thermography and it showed an infection, and the dentist does x-rays and we don't see any infection. You cannot see
Well, it was interesting because I asked the same question today of the dentist when they took the x-ray, because I don't like getting them. But I wanted to make sure that maybe there wasn't a piece of tooth that was still up in that area. And he was trying to show me but when he looked at the x-rays, he you could barely see an outline of an infection area. So obviously that's the case.
Yep.
Yeah,
Well, I'm glad you got that
at
taken care of. Now you're going to use the tooth and gum oil too. So
yes, absolutely.
that's going to help.
Yeah, I was talking to Angie about that today, and just as a footnote, Angie did say that you might want to have your thyroid checked, and you might have have you because it suggests something in as a possible urology related in my lower extremities, and she was kind of saying the same thing. If you're not having any issues, it may just be that they're just showing an abnormality on their end. But you just clearly explained that what goes on when they actually read through these probably 100 a day, and really take a look at it. So, okay, and I had another quick question. I'm going to be doing a PET scan coming up for some other purposes other than to see where I'm at in comparison from over a year ago.
Yep.
What precautions would you recommend after I get this poison radioactivity put in me?
Okay, so did you get a foot bath with your wife?
No.
Okay, so I think what we'll do is we'll send you a foot bath, because that's a great way to help with detoxing radiation, plus a radiation homeopath. So we've created a 12x homeopath for radiation that will help detox radiation from your body after a CT scan or a PET scan. So that's the best way to do it. You can also use a chelator for the dyes. A chelator doesn't work really for the radiation, but a chelator could work with the dye that you have to use.
I've chelated before. I make my own mixture, but I don't know if you have something for chelation, but
yeah, and you can use a mixture that you make too. So there's a lot of different chelating agents. Chelation just means to grab onto.
Right.
So.
Right. Do you have chelation products?
Yep, we do. So I'll put something together and get it ready, and Angie can call you tomorrow and tell you how to do it.
Fantastic. I mean, I don't want to take up too many people's time, but I just had a quick question on the Rife machine. When you're operating it, is it better to be on bare skin as opposed to through clothing?
I'd say there is probably a benefit. I don't know that there's that it's a phenomenal benefit. It's anything that's going to be a barrier is going to decrease the potency, if you want to say that, of the effect of the light frequency. So yeah, I have a shirt on when I sleep, so it's going through a shirt. But if it was going through a pillow and another couple blankets, then it's certainly going to decrease the effect of the Rife machine. So if you're in more of an acute phase, I'd try to do it as strong as possible.
Right, and my neck area is the one I'm concentrating on. So when I'm using it when I'm not sleeping, is it beneficial to have it right up against the area that you're trying to?
Yes, I would do that. Yes.
The light portion of it, obviously.
Yep.
And last question: What's the best full body cleanse that you would recommend, or do you have a full body cleanse protocol?
Well, if we give you a
slash-
chelator, that is not going to be solely specific to anything. So that's going to help be a full body cleanse. So let's say if I'm doing if I'm doing modified citrus pectin right now, that has IP6 in it, and it has modified citrus pectin, that MCP synergy that we use on many patients. That is a chelator. And that is not going to be, let's say we tested your cancer and it came up heavy metal toxicity as the cause, and we put you on any sort of chelator, Chelex or MCP synergy, that tested out to pull out that heavy metal or that pesticide or that chemical or whatever it is. It is not only going to pull out, it's not going to be solely specific to that. It's going to pull out other garbage, other chemicals as well. So that is in effect a whole body detoxification.
Oh, so it would be cleansing your liver, your colon, your kidneys.
Yes, it is. Now there's other things that you may want to do to support liver detox pathways. There's other things that you may want to, but we'll get into that.
I'm doing my coffee enema, Doc.
There you go. Good job. You get a gold star.
If it's determined that you have a infection in your, for dental, how do they treat that? With antibiotics or?
I go to a holistic dentist. He did take out. I only had limited amalgam fillings, mercury fillings left. But when he did remove those about, 8 months ago, he was surprised at the amount of vapor that it gave off. But it was just a filling. It was a filling that it was a cavity that he had to fill. But I do have two crowns that have metal on. They're relatively new, but I was kind of asking him today if there's any way to test how much heavy metal toxicity is coming off of those. And he said that there really isn't. So, but I do know that I need to get, that's the last of the metal that I have in my mouth.
Well, doctor, I'm talking about the infection. If you have an infection.
So if you have an infection, what's the best way to treat it?
Yeah.
So I think using the tooth and gum oil is the best way to treat it. Now, how would if the dentist saw encapsulated infection in your gum, then if they can see it on an X-ray, then it's much more pronounced. It's much more "quote unquote" serious.
Yeah.
And they would be more apt to use an antibiotic in that case.
Okay.
Is that in your best interest? Well, I would weigh that out, because an antibiotic is going to be systemic and it's going to throw off your flora, your microbiota, and it could do more damage. So if you could do it without using an antibiotic, that would be better. I'm not against antibiotic use in certain cases, but if you've had this long, prolonged dental infection for a long time, you could probably try to do it with the tooth and gum oil or something like that, and instead of trying to hit it with an atom bomb of an antibiotic. If you have this raging infection in your tooth that's causing sinus issues and other things, then maybe you need to use an antibiotic. So.
Okay. And one quick question: Did you get the genetic testing back yet?
That's really a sore spot with me right now. So it's out of our control completely, because we're not the ones doing it. But it's kind of out of the control of DNA methylation too. They're waiting on Rutgers, who's going to be running the test, to get all their ducks in a row. We were supposed to get the kits this week. I guess the week isn't up yet, so we're still got our fingers crossed.
Okay.
Should you get your DNA retested if you had it already with 23andMe?
If you had it done with 23andMe on their old platform, or what's called their old chip, chip number 4 or less, then no, you should not get it retested. If you had it tested on chip 5, you may want to get it retested. It depends on what we found on it.
How do you know which is which? Which one you have?
I will have to look it up. So email me. Is this Deb?
Yes, this is
Okay.
Deb.
So I'll look it up and see what yours was on. If it was on chip 5, I will let you know. If it was on, if you don't hear from me, it was on chip 4.
It might be chip 4 because it's not that new.
Okay, so yeah. So if it was done after September 2017, then it's chip 5. If it was done before September 2017, it's chip 4.
Okay, I'm okay. Thank you.
Okay.
So which one is the good one? 4 or 5?
4. So last September, they tried in an attempt to compete with Ancestry.com. They cut out about 75% of their genes.
Oh boy. Well, I believe mine is after September that I just came up there and I believe you looked at.
Okay, yeah, I can't remember. I'll have to look at yours again.
Dr. Connors?
Uh-huh.
In your seminar there you was given on this, are you saying, am I getting out of that a little bit of sun is okay, and that therapy through hormone therapy is not such a bad thing if done right?
So is a little bit of 2 different questions. Is sunshine good for you? Absolutely. Sunshine is wonderful for you. Is getting sunburn good for you? No, that's not good for you. Is using sunscreen good for you? No, that's not good for you either. So next week, I'm not going to be here. I'm going to go to Hawaii. So hopefully, Lord willing. And when I go out in the sun, I do not use sunscreen. Now I have maybe what would be considered black Irish skin, and I don't burn really easy if I'm careful. I cover up. And but some people have very Norwegian skin, and they burn really easy, and they cannot go out in the sun without just burning, no matter what. Those are the people that would behoove them to get a natural sunscreen. You can buy it over the counter at Amazon, from some natural house. There's many recipes that you can make your own as well. My daughter makes her own natural sunscreen. But sunshine is good for you. Getting sunburned repeatedly can lead to skin cancers, but the sun does not cause skin cancer. So the sun is your source of vitamin D and is beneficial for a whole bunch of reasons that we could talk for an hour on. Second question, is hormone therapy, are you talking about the Lupron therapy?
Not necessarily, like, not that I know some women have had compounded.
Okay, so is bioidentical hormone replacement therapy a good thing or a bad thing? So one of my fellowships is in functional and anti-aging medicine, and that whole group is really big into bioidentical hormones. Now, because my specialty is cancer, I don't really adhere to a lot of things that they would adhere to. Now, they're doing bioidentical hormones to help a person feel younger or longer, and there can be arguments that could be very beneficial. Now, if done right, I don't think it increases one's risk for cancer. But you have to stay well monitored. So a woman who's like going through horrible menopausal symptoms and goes on a bioidentical hormone replacement therapy approach, and it's done correctly, I don't think that increases their cancer risk. If you go on standard hormone replacement therapy, it highly increases your cancer risk because they're not using bioidentical hormones. Right on the packaging, Google this if you need to, it gives you a 10 times risk for hormone cancers, especially if you have some specific genetic predispositions. So if you have tumor suppressor genes in defects in certain tumor suppressor genes, you should not be doing hormone replacement therapy as a woman. So there's other ways that you can help yourself get through menopause. Particularly, we're getting way off subject here, but a person that goes through menopause and has a lot of symptoms going through menopause, then you know, so normally your ovaries decrease progesterone and estrogen production. That's what menopause is. Now, your adrenal glands also make estrogen and progesterone. And if a woman has healthy adrenal glands, that's the woman who says, oh, I went through menopause. I didn't have any problems. I don't know what your problem is. And then woman B is like, I go through menopause. I got hot flashes. I feel like crap. I don't know what's wrong with me, blah, 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 blah. Well, that's the person who has adrenal issues. So by supporting adrenals and by naturally using things like chaste tree and maca root, and there's a bunch of different herbs that can be really beneficial to help a woman go through menopause without having all these hot flashes. You could not only not increase their cancer risk, but you can help them balance out those hormones through that. So I have never been really a fan of even bioidentical hormone replacement therapy, just because I just don't know if there's enough studies that that is real safe. But it's been going on for about 20 years now, and there really isn't any proof that it increases cancer risk if it's done correctly. So I kind of changed my view that it's not really wrong if it's done correctly. So hopefully that answers your question. Okay, so it is, we've been going on for 70 minutes here, so we better cut off our conversation now.
Okay, Dr. Connors?
Yes.
Dr. Connors. Lewis here again. I do have an appointment with Kelly for tomorrow afternoon to go over my 23andMe test. So I guess you might want to look to see
she'll go over. Yeah, she'll go over. It's still going to be beneficial to go over it.
Okay.
So, still keep that appointment for sure.
All right, and then last thing is, so you're gonna put together something for me for as far as the PET scan and foot test as well.
I have my note right here.
And chelation as well.
Yes.
Last question. How do you feel about the use of Lugol's iodine in addition to what you have me on?
Okay, let me mute everybody and I'll talk about that. Okay, so Lugol's iodine. Is iodine good for people with cancer? So iodine can be very beneficial for people with cancer, except I'm not a big fan of Lugol's iodine. So Lugol's iodine solution is not a natural organic source of iodine. So if we're going to use iodine, I'd rather have a person use a kelp-based iodine. It's really available everywhere. We have a product called sulforomethionine, or no, it's selenomethionine, and it's a kelp-based iodine. It's pretty much available. You can buy kelp chips. You know, they're horrible, but you can buy them. But I'd rather have you get your iodine in a natural source. Just like going back and watching, we're going to try to index our videos and index these Zoom calls so it's easier to go back and search for them. But I did a video, I think back in December, about looking at nutrition and how to know whether your supplements are good or not, whether they're whole food or not, whether they're synthetic. And that would be a valuable one to watch when you look at iodine. Matter of fact, I did a whole Zoom call on iodine. I think I did 2 of them. So go search back and look at those videos. How you do that? How do you search back and look at those videos? Scroll down on the Facebook page. Keep scrolling down. Every Zoom call has been uploaded to Facebook. So scroll down on the Facebook page and look at those videos. And hopefully within the next couple of weeks, we're going to have them indexed. We're also going to have our blog indexed on our website. And I don't know if anybody's looked at our new website, but we've just really tried to classy it up a little bit. And you know, if I I've figured out in the last couple of weeks that if I can't make it as a doctor, I'm going into web design because I've gotten really good at making my website. So if you guys need your website done, just let me know. But but scroll through that, Lewis, and look at some of the videos on iodine. And you can talk to Dr. Kelly about that too.
Perfect. Yeah, I'm really excited to have the access now to be able to go through all of your stuff. Very intriguing.
Absolutely.
I just want to thank you very much. God bless you, Dr. Connors, and everybody listening, and enjoy your vacation.
All right, thank you. I'm going to say goodbye now, and we will talk again next week.
Good night, Dr. Connors.
Thank you.
Thank you.
Bye-bye, everybody.
Good night.